Hello, my name is Paige Nelson. I'm a rising second year graduate student in the Department of Psychological and Brain Sciences at the University of Iowa. I worked on this project with Francesca Scheiber, Haley Laughlin, Allison Momany, Kelly Reichman, and Ejay Demir-Lira. And today I will be discussing the role of literacy activities in preterm and full-term children's vocabulary acquisition. Just a little bit of background on prematurity. A premature birth is defined as a live birth before 37 weeks gestation. Every year, close to 15 million children are born premature, and according to the CDC, 1 out of 10 children in the United States are born prematurely. When babies are born premature, their developing neural tissue is interrupted, which causes an increased risk for death, disability, and delays. Babies who survive being born premature may have developmental delays such as cognitive delays, and that's what I'm going to focus on today. One of the most severe cognitive delays preterm children often experience is a language delay, which is frequently associated with the degree of prematurity. In explaining cognitive delay, however, previous focus has been on the role of biological factors, such as early prematurity. However, 75% of premature children are born moderate to late preterm, between 32 and 36 weeks gestation. And the few articles focusing on moderate to late preterm children suggest that this group is also at an increased risk for severe learning delays. To help visualize, here we can see drastic differences in brain growth between extremely preterm, and term. And as indicated here, babies begin a brain growth spurt around 35 to 37 weeks gestation. And if a baby is born in this time frame, this growth spurt is significantly interrupted. Recently, literature focusing on parental socioeconomic status has shown that SES might moderate the relationship between prematurity and cognitive outcomes, where negative cognitive outcomes are higher in preterm children from disadvantaged SES backgrounds compared to those from advantaged backgrounds. However, parental SES is a composite measure that consists of many subcomponents, and it can be difficult to directly pinpoint its subcomponents to aspects of children's cognitive development. With this in mind, recent studies on term children, those born between 37 and 42 weeks gestation, has focused on the role of immediate parent-child interactions on children's cognitive development over and above SES. However, little is known about proximal parent-child interactions that might predict premature children's outcomes. So we examine the role of parent-child language literacy activities in preterm and term children's vocabulary acquisition over and above broad demographic factors such as SES. Given the common difficulties preterm children often endure, which I'll focus on later, parent-child language literacy activities may play less of a role in preterm children than term. Or on the other end, due to the possibility of increased plasticity, parent-child language literacy activities may play a larger role in the preterm children. So with this in mind, we also asked if parent-child language literacy activities plays the same or different role for children born at different gestational ages. Our study sample included 116 children 4 to 5 years of age. Children were further divided into 4 groups based on gestational ages across the full spectrum. We had 17 early preterm children, those born at 32 weeks or less, 18 late preterm children, those born between 33 and 36 weeks, 21 early term children, those born between 37 and 38 weeks, and 60 term children, those born 39 weeks or later. Some other demographic variables measured included birth weight, household income, and parent education. Household income was measured continuously and there were no significant differences between groups, and parent education was measured categorically, showing that the average education corresponded to a bachelor's degree. 85 parents and children, preterm and term, were invited to the Development Experience and Neurocognition Lab at the University of Iowa to participate in one 3-hour study. Due to COVID-19, however, we moved data collection online, where the rest of our sample, 31 parents and children, were invited via Zoom to participate in 4 30-minute sessions. During the study, children completed batteries of neurocognitive testing with members of our research team, and parents completed behavioral and cognitive-related questionnaires on their child. As part of the larger study, consenting parents were administered 2 particular questionnaires, one assessing language literacy activities, one assessing child vocabulary skill. To assess parent-child language literacy activities, we ask parents to answer questions about how often they engage in various formal and informal language literacy activities with their children, using a Likert scale from 1, which was never, to 7, which was multiple times per day. Using a book as an example, formal language literacy activities are those for which the parent and child focus on the print. For example, parents were asked to report on how often they print letters and words together. On the other hand, informal language literacy activities are those for which the primary goal is the message contained in the print. For example, parents were asked to report on how often they read with their child. To assess children's vocabulary skill, parents were administered the Developmental Vocabulary Assessment for Parents, also known as DVAP. The DVAP is a 212-word inventory comprised of words the average child learns between the ages of 2 and 18. Parents were asked to check all words from the inventory that they have explicitly heard their child say out loud. For example, some of the words included bike, happy, dancing, and pedestrian. So, in looking at the role of parent-child language literacy activities in preterm and term children's vocabulary acquisition, we ran a sequence of 3 linear regressions to see how much group and language literacy activities predicted vocabulary acquisition. Group was dummy coded with term used as the reference. Each model included child age at testing and parent education as covariates. In all models, there was a main effect of group, where the late preterm group performed higher than their peers. In this model, Model 1, total language literacy activities was found to be a reliable positive predictor of vocabulary acquisition. In Models 2 and 3, formal and informal language literacy activities were found to be reliable positive predictors of vocabulary acquisition as well. Given the small sample size, the interaction component between group and parent-child language literacy activities was added to each model last. The interaction component did not significantly add to the first 2 models when examining total and formal language literacy activities. However, in Model 3, when examining informal parent-child language literacy activities, there was a non-significant trend in the sense that informal language literacy activities matter more for late preterm over term. I just want to note as well that all results reported remain the same when a continuous measure of gestational age was used, and group was not a reliable predictor of language literacy activities. To help visualize this trend, the x-axis represents the quantity of informal parent-child language literacy activities, and the y-axis represents children's DVAP score. Red dots represent the early preterm group, green dots represent the late preterm group, blue dots represent the early term group, and purple represents term. To some, the results showed that parental cognitive stimulation might predict outcomes more than broad factors, such as parental SES. Specifically, results showed that parental language literacy activities predicts vocabulary skill in both preterm and children, but the relations might be stronger in late preterm children than their peers. Prior research shows that the role of parental language input is linked to child brain development and child vocabulary acquisition, as shown again here in our results. Also, children born preterm are more dependent on their parents due to behavioral and emotion regulation issues that they sometimes experience. Therefore, parent-child interactions might play a greater role for preterm children. Also, brain plasticity, commonly defined as the brain's ability to change via network growth and reorganization, is a means through which children born premature have shown resiliency and adaptation to adverse environmental stimuli and change. The current literature often refers to plasticity as a double-edged sword. On one side, children born prematurely are more vulnerable to brain injury due to the fact that their actively developing neural tissue is quickly interrupted. On the other side, due to this interruption, it's possible that positive enrichment in environmental experiences can be leveraged to support healthy cognitive development. Our results are consistent with the recent hypothesis that prematurity, specifically late prematurity, might exhibit a heightened case of plasticity, where environmental influences such as parent-child activities might play a larger role in preterm children's outcome than term. This also aligns with the differential susceptibility theory, which broadly states that children react differently to environmental influences, such as parental input and parenting styles. Recent literature on this theory has found some children to be born more susceptible to both positive and negative environment, which further supports our findings. With this said, I just want to share three take-home points. One, these results should be interpreted with caution due to our small group sizes and a narrow measure of parent-child language literacy activity. We are in the process of broadening our sample and adding more proximal observation measures. Two, type of parent-child language literacy activities and degree of prematurity might have different relations to children's language development. Specifically, results showed that total informal and formal parent-child language literacy activities predict children's vocabulary acquisition, but the relations might be stronger in late preterm children than their peers. For example, one component of informal parent-child language literacy activities that we focused on was book reading, which has been shown to be a rich area for children's vocabulary skills. Lastly, degree of prematurity could be thought of as a plasticity factor in explaining the different patterns between early preterm and late preterm. Once again, our results are consistent with the hypothesis that degree of prematurity might predict plasticity, where environmental influences and support, such as immediate parent-child activities, might play a larger role in late preterm children than early preterm. And we hope our findings can contribute to the implementation of more immediate parent-child interactions for preterm children. And with that said, I would like to thank the Development Experience and Neurocognition lab members, family, and children. Thank you.